Veterinarian is going to show you how to do a head-to-toe exam on your chicken.
So this is basically, you don't have to be a vet to do this. However, the main thing you want to learn is just to pick up what's abnormal for your chicken and what's normal. So the first thing you want to do is you're going to want to just look at them from afar. So take a look at Millie walking over there. Does she seem to be putting equal weight on both steps? Are her wings tucked nice and close into her body? Does she seem to be having any limping or anything? She's walking just fine. Next, we're going to check out their head. So we want to check out all of their wattles. We want to look at their wattles, their comb, as well as their little earlobes here. Make sure, you can see hers is a little discolored. She actually got a little frostbite over the winter, and some of these guys, you'll notice of our chickens, they're missing kind of the top of their wattles. That got a little damage from frostbite. We'll talk to you in the winter about how to prevent that. But as you're looking at her head, you want to make sure she's symmetrical. So you look at both sides. Is either of the wattles swollen? If they're swollen and they look puffy or they're oozing, you're worried about it. Look at her beak and make sure that that's symmetrical. Make sure her eyes are opening and closing fine. Their little ear canals are right here. You want to make sure that those don't have any discharge from them as well. Okay, next you want to take a look at her beak. Make sure their little nares, which are these little holes at the top of her beak, don't have any discharge and they're nice and clean. Check out her beak. The top of her beak should go over the bottom of her beak, and the bottom of her beak should protrude just underneath there. Sometimes these guys can actually have deformities where you have to trim their beaks. Make sure there's no cracks or swelling around her beak too. Also take a look at her eyes. Right now I'm petting her and she really enjoys it, so her eyes are closey, but make sure they're nice and bright and there's no discharge. Make sure their eyelids, when they close, go all the way up and close. You can even take a pen light and just flash it into their pupils, which should be nice and round. Make sure that their pupils are constricting when you flash the pen light there. All right, this next one might be a little more difficult. You want to open their mouths and just take a quick peek in there. They usually don't want to hold still very well, but you're just looking to make sure there's no discoloration of their mouth. Usually you can't do that unless they're sedated, but that's another thing that you just want to take a quick peek. If you're seeing any funky discolorations like black or bright red, like there's ulcers, then we're more concerned. So Nugget is misbehaving during our video, so we put him on his back to keep him from crowing and running around attacking us. He's kind of stuck now. Next, as you're going, you want to just palpate along their neck. Make sure nothing seems painful, and then you want to go down to where their crop is. Their crop is about 3 inches from where the top of their neck would be down to the bottom of their breastbone. When you feel the crop, it should feel nice and doughy. This is where the food goes and is softened prior to moving into the stomach. It should be empty if you check it in the morning, which means that they're digesting properly. But you should be able to kind of feel a little food around there. If at any point when you open their mouth, you're smelling something really sour or rotten, or if you go to feel this crop and it feels like it's really big and rock hard, that could be sour crop. So then you're gonna have to treat for that. Okay, next you wanna take a look at her feathers. So as you kind of pull them backwards, you should be able to get down to her skin. When you see their skin, it's kind of hard to see because they have lots of feathers. It should be pretty translucent. So take a look here as I pull back her feathers. See that skin down there? It should be kind of translucent, a little coloration. I mean, basically what you're looking for when we're doing this is to make sure their skin's okay for color. And at the same point, you want to make sure you're looking for mites and lights and fleas. You'd see those at the base of the feathers, and trust me, you'd see their poop all over the place. Then the other thing you want to do is just kind of extend their wings and take a quick look to make sure all of their feathers look really healthy. She doesn't try to fly away, so we don't trim her wings, as you can see, we trimmed them last year, but they're all growing back, so she had a molt. If you do see an area where there's no feathers, you should see what's called pin feathers, which are basically new feathers. Now, none of our chickens are actually missing any feathers right now for us to show you, but you'd be able to see it. If you don't know what a pin feather looks like, just search it up online. As I said when we showed Millie walking around, you want to make sure their wings are nice and tucked. Now when it's really hot out, you may see their wings puffed out because they're trying to cool themselves down. But when it's nice and cool, they should be walking with these wings nice and tucked like Millie and our broody chicken in jail is doing. We have her in the garage because it's super hot and she's just sitting out there panting. We don't want her to get heat stress. Either way, you also want to check, just feel along their little bony premise up here, and you're going to check all the way down to their pelvis and make sure nothing seems painful. It almost feels like little bumps and ridges going down there. This is where all the weight is. So you want to make sure that you don't feel any pain or swelling along those areas as well. At the same time, you can go along that breastplate with your fingers and just feel down along to make sure you're not feeling any abnormal swellings on each side. Next, you also want to check their vent. So this is where the egg comes out and this is where they poop. Make sure it's a nice soft pink color. It shouldn't be protruding or have anything do any protruding. You can pull up this area a little bit and just make sure everything looks nice and soft pink. At the same point, make sure they don't have any abnormal droppings stuck to their feathers. If they do, that could mean that they're dealing with some sort of disease. So as long as that's looking all nice and clean, you're good to go there too. At the same point, when you're looking at your chickens and cleaning out, make sure you're checking their droppings. At some point, we're actually going to do a video on showing you different types of poop and what's normal and what could be abnormal. But we honestly have to get some abnormal videos first in order to show you what's abnormal. Next, we also want to check their feet. So again, you're looking for any abnormal swellings or pain, and you also want to look specifically for bumblefoot. So touch this soft pad. Make sure you're not seeing any big swellings. A lot of times the bumblefoot happens right here. It would be very, very stiff, hard to the touch, and super painful. Hers look completely normal. They're a little dirty because she was digging in the dirt, but you want to make sure we're not finding any bumblefoot, because the quicker you treat that, the easier it is on you and your chicken. Next, you also want to listen to her heart and lungs. So you're going to kind of move it around. So when you're holding her, if you put it right in front of their leg, you should be able to hear their heart. You want to put it on both sides, so you're listening to the right and the left. This is kind of a scary device. She doesn't get this done very often. So you're listening on both sides. And their little air sacs are a little higher up. I tell people, honestly, what you want to do is just kind of listen all around on their chest. And I know you're not a veterinarian, but let me be honest. The way veterinarians learn what's abnormal is they practice a lot. So the more you listen to your chickens and the more you hear normal, you are going to be able to pick up abnormal, even if you're not a veterinarian.
There you go, folks. There was a brief exam on your chickens.